Good afternoon, everybody who's just joining us. We're just going to give everybody a couple minutes to get logged in and ready to go. If you're just joining us, if you want to add to the chat, just your name, what organization you're representing, just a little hello to everybody. Hello, everybody. Thanks so much for adding your name to the chat. So nice to see everybody. We'll get going in just about a minute while we're just waiting for everybody to be admitted from the waiting room. Seeing lots of our friends and partners, the Diaper Bank. We're so excited that everybody's here with us. All right, y'all. So I think we'll go ahead and get going. If people are just joining us or being logged in right now, if you just want to go ahead and throw your name in the chat, your organization that you're representing, that would be awesome. We'll keep admitting people too if we're waiting for any team members. So just a reminder, this webinar is being recorded and we'll be sure to share it with everybody within the next couple of days or so. So again, good afternoon. Thank you all for joining us for this webinar. We're really excited to be able to have a conversation with all of you. My name is Jenny, and I'm the Advocacy and Outreach Coordinator here at the Diaper Bank of Connecticut. Before we get started, I just want to say a big thank you to all of the legislators participating in this webinar. We're very lucky here in Connecticut, and we at the Diaper Bank consider ourselves lucky to be in a state where so many of our legislators and our state officials really prioritize the health, safety, and well-being of Connecticut families. I also want to say a big thank you to all of our DBCT partners, the folks that are doing this work on the ground, all of the care providers, community members, and just everybody who's working nonstop to ensure that families have what they need to be successful. Just to be respectful of everybody's time, we just ask that you keep yourself muted during this conversation. There'll be a little an opportunity towards the end of the webinar for a little bit of Q&A in the chat feature. So if anything comes up, we'll definitely have an opportunity to address it. Now to just introduce our panelists. If our panelists just want to give a little wave as I say your name, that would be awesome. So first we have Janet Stolfi Alfano, the CEO of the Diaper Bank of Connecticut. Dr. Selina Osei, the Director of Health Equity and Community Engagement at CHA. And then we have Representative Jillian Gilchrest, and then the Executive Director of the Connecticut Early Childhood Alliance, Merrill. So thank you so much to all of our panelists. These folks are all doing amazing work, and we're really excited to be able to have their expertise today. So kind of just to kick it off, Janet, can you give us a little bit of an overview on diaper insecurity in Connecticut and what the need is looking like?
Sure. Thank you, Jenny. And again, thank you everyone for participating today, for your dedication and commitment to Connecticut's families, for the folks who are on the call. What we know about diaper need, and as defined as the inability to diaper your baby, to be healthy and safe and dry. Before COVID-19, it was roughly 1 in 3 families suffered from diaper need. Based on a recent Diaper Check 2023, it's about 1 in 2, and those are national numbers. But we know that in Connecticut that is the same. When we look at data in Connecticut, using first the DSS dashboard that shows the number of children by age group who are covered under Medicaid, which is roughly 200% of the federal poverty level, so double the federal poverty level. There's about 18,000 children under age 1 and another 77,000 children ages 1 to 4 who are using Medicaid as their primary health insurance. So they're at or below 200% of the federal poverty level. If you're using that as a marker, which, conservatively we would, but what we know is that even folks above that income level experience diaper need. If folks saw the recent ALICE report from the United Way of Connecticut, and ALICE stands for asset limited, income constrained, and unemployed. There was a recent report that showed that basically for a family of four in Connecticut, they need $106,000 as a household survival budget. And when I think about that, personally, and for most folks that I know, I think are vastly under that. So we know that this need is significant and that it is growing.
Thank you, Janet. And to you, Merrill, as Janet mentioned, the percentage of families that are experiencing diaper need and the cost of living in Connecticut has certainly gone up. Can you sort of speak a bit about how diaper insecurity kind of fits into this bigger picture of childhood poverty in our state? Oh, I think you're muted,
Yes.
Merrill.
Rookie mistake again. Child poverty is up in Connecticut with the end of the pandemic child tax credit. What we found was that we're now above the pre-pandemic limit percentage of children in poverty. So about 1 in 8 children are in poverty. That the numbers that Janet just talked about, 18,000 children under age 1, that's about half of the birth cohort. And it's very clear that the cost of living has eaten up parents' disposable income. The cost of housing, the cost of childcare, the cost of everything has gone up. Diaper need fits in there because it is much more urgent than the phone bill that's due at the end of the month. If I don't have diapers right now, I've got an immediate problem. And that's a problem that makes it difficult to do any of the other things that as a parent you need to do. The level of urgency that comes with the fact that I've just fed my child and now something's coming out the other end it lifts it on the priorities, and yet it is the thing that is not covered by any of the social safety net programs. You can't use SNAP for it. You can't use your housing subsidy for it, your Care for Kids subsidy. Any of those things won't help you with diapering your baby.
Thank you so much, Merrill. And just kind of as a follow-up to that, how does having access to these supplies, these expensive products, kind of free up families' economic resources for other, like you said, housing and all that sort of stuff?
Well, obviously, when you don't have to spend it on diapers, you can spend it on something else.
Right.
And I think we'll talk later about how the impact on childcare, access to childcare. Most childcare providers require you to bring diapers. And if you don't have those diapers to bring, it doesn't take very long before your childcare provider starts to challenge you on that. And that makes it difficult to go to work.
Right, definitely. And then Dr. Osei, just to kind of, paint the whole picture of what diaper insecurity can look like on, to a family. Can you speak a little bit about the health outcomes and sort of the well-being of the family when families are unable to afford these products?
Sure. Thank you, Jenny. And thank you, Janet, for inviting me to be part of this discussion. So in terms of health and well-being of a family, I mean, when we're talking about diapers here and the focus really being on infant diapers, right? The basic necessity for babies is diapers, like when they are born. And so from that angle, not having enough supply of diapers to provide a newborn means that for most families that are experiencing diaper insecurity, it means that they are staying in one diaper for a long time, and that can lead to health outcomes such as diaper rash that most people might be familiar with, but also staying in dirty diapers for a long period of time can eventually lead to urinary tract infections, right? So many of that means that you're going to be showing up in clinics and emergency departments multiple times in a month. And that also directly influences a family or parent's ability to go to work. They have to miss work to take the child to the clinic and all of that. We also know that for some young mothers, especially because that's what the study was focused on, that you need a 2-week supply of diapers to be able to take your child to daycare. And so not having enough supply of diapers means that they have to kind of determine what type of job they're going to take, and sometimes they miss work. On average, most families miss about 5.1 work days, which equates to about $6,000 of lost income on average. And that's significant. If you're thinking about the statistics Janet just talked about, you need 106,000 for a family of 4. It's very significant. So what that contributes to in terms of the parents' health and well-being is a stress factor that eventually manifests in depressive symptoms. And that's kind of also been validated through research, really done in Connecticut as well.
Yeah, I was wondering if you could maybe just expand a little bit on the maternal mental health piece, just a little bit about that research and the findings of that.
Sure. So I believe it was the Yukon Economic Analysis Center that did this study a few years back that looked at a cohort of mothers who were experiencing diaper insecurity, and significantly providing diapers consistently yielded improvements in symptoms of depression, and also improve the outcomes of their babies. Based on that study, particularly, we think that we understand that providing the resource to the families will help the mother kind of manage their stress symptoms related to taking care of their babies.
Mm-hmm.
And that's the basis for the work that we're doing together with the Diaper Bank of Connecticut.
That's awesome. Yeah, thank you, Selina. And then to Janet, just the families that we're working with here at the Diaper Bank, I was just wondering if you could speak a bit to that as well.
Sure. So just in following up a little bit, if you will indulge me, in what Dr. Osei was speaking to, what's wonderful about the state of Connecticut as a state is that we've led a lot of the research and efforts to study this. And Selina referenced the economic analysis that was done by the Connecticut Center for Economic Analysis at UConn, which looked at a lot of the economic impacts and the magnifying impacts that providing diapers has on income generation for the individual and for the state. And then the other piece, which was really exciting that we touched upon, is the study that looked at the link between maternal depression and diaper need. That was through the New Haven Moms Partnership through Yale. And that it looked at a number of different factors like housing insecurity, food insecurity, violence in the community. And what it looked at and found out was that there was a high correlation between maternal depressive symptoms and diaper need. In fact, it was higher than any of those other categories. And that even shocked us being in the space. We understood how stressful it is. But to Merrill's point earlier, it is a stressor that you're going to be faced with, every few hours for several years. And it's a fundamental part of your ability to, take care of a child. I know one of the things when I became involved with the Diaper Bank back in 2007 that struck me was that as our founder did home visits to families in New Haven, and she had a little checklist that she had to fill out. And, one of the checklists was, does this family diaper their baby appropriately? Like the number of times that you're supposed to. And she could have technically referred that family to, DCF or another state's Child Protective Services because they were not diapering their child appropriately. So it's very stressful for families. And we're lucky that we live in a state that really cares so much about this issue.
Yeah, and thank you for that, Janet. That kind of cues up nicely for Representative Gilchrest. Something that the Diaper Bank has been advocating and thinking about for a while is Medicaid coverage for these products. And we're really grateful to have a leader in the space such as yourself to help bring up these conversations and start really looking into that. I know a lot of work has been happening over, the past year or so to start exploring these options. And I was just wondering if you could give us a little bit of a status update on some potential policies that we might see.
Sure, great. Thank you. And thank you for having me today and for the work you do. So in the state of Connecticut, we do have the Diaper Bank of Connecticut does receive a line item, which is fantastic. And we're proud of that. And that money goes to do this great work. But as Janet was saying at the start of this meeting, the need is just so great. And so if we can ensure that there's other funding streams that can help support this work and get diapers to the families who need them, that is imperative. And so what we've been doing through the Human Services Committee at the legislature is we have a working group that is looking at health-related social needs. HRSNs is the language being used by, here's a lot of acronyms, CMS, which is the Center for Medicare and Medicaid. And there is an initiative at the federal level to address health-related social needs. Now, there needs to be a nexus between medical needs and health-related social needs. And we believe that the nexus is there when it comes to diapers. And as you just heard, not only does a lack of access to diapers impact a baby's health, but it also impacts a mother's health. And so feeling very positive that those conversations are ongoing. And we're really trying to figure out how we could use Connecticut's Medicaid program to apply for a waiver to the federal government to be able to cover diapers in some capacity. This would be positive because we would get a match from the federal government. What we're seeing right now, as this work is unfolding, is that some of the barriers that we're trying to address are that with an upcoming potential change in administration, a presidential election next year, there are a lot of states who are applying to CMS for Medicaid waivers. And so if we are to move forward with a proposal that would include diapers, we would need to prioritize it this legislative session and maybe even speed it up quicker than our typical schedule for the legislative session. And so still, though, very optimistic because those conversations are going really well. And there's a lot of, even the people here are really helping talk through what that proposal would look like for the state.
Awesome. Thank you so much, Representative Gilchrest. Thank you for all of your advocacy on this as well. And I just want to ask Janet, Medicaid, again, it's this thing we've been thinking about for a while, but we know that the process isn't going to happen overnight. So I was wondering if you could just kind of touch on which resources do families and providers have right now, if they have families that they work with that are struggling for these products.
Thanks, Jenny. Almost made a rookie mistake myself. So right now with, as Representative Gilchrest alluded to, we are lucky in Connecticut to have a line item in the state of Connecticut's Department of Social Services budget and a few sources of COVID-related emergency funding and grants and really generous donors and support. Through all of those, about 6,500 infants and toddlers is who we are serving each month. Through trusted partners across the state and every county in Connecticut. And those are partners like community action agencies, hospitals through the Diaper Connections program with Connecticut Hospital Association, childcare providers, home visiting programs, really any and every type of program very intentionally so that we ensure that we capture providers, one, where families are geographically located, and two, where they have trusted relationships. And some providers, particularly some of our faith-based providers, that is their primary service that they offer. They might not offer other services, but for that family, it's a trusted member of the community that they're going to who's meeting that need. And that might be what they can handle right now in terms of services or provision. there's a lot of organizations across the state of varying sizes who are also responding, to diaper need. And again, we are so lucky to be in Connecticut where, we're hitting our 20th year. So hopefully folks have heard about the issue of diaper need and are understanding what it means and how they can help support it in their own community, even if it's not in partnership with us, just because of, capacity and funding. And so for right now, that's what's available. What we are always looking for is an innovative way that we can be most impactful in something like figuring out how to get diapers covered under Medicaid would impact, thousands and thousands of children in Connecticut who might not be able to access resources currently. And so that's why for us, it's critical to not only provide the diapers ourselves through trusted partners, but also to ensure that as much as we can talk about the issue and amplify why this is so critical for families and look for other policy solutions, because the government has already decided that diapers or products like diapers are medically necessary for different populations, such as older adults and children who have special healthcare needs. And so we just want to expand upon that work, and hopefully we can do that.
Awesome. Thank you. Thank you so much, Janet. And Selina, so Janet kind of mentioned this a little bit, but when talking about some of these innovative programs that we're working on, CHA and the Diaper Bank have been working together on this program called Diaper Connection. Could you give us a little bit of background on that, how that came to be, and what that program really is?
Sure. Thank you, Jenny. And so, like Janet mentioned before, when COVID hit, the observed volume of need for diapers increased significantly, and it's not reverted once the claimed COVID was over. It's been sustained. The need is sustained at 1 in 2 families, and it's even higher, I would say. The opportunity to partner with the Diaper Bank of Connecticut really came from the support from the Department of Housing under the ARPA funding, COVID ARPA funding, community block grants, to support some of the interventions and initiatives that organizations like the Diaper Bank of Connecticut were deploying over the 2-3 years that we were experiencing the impact of COVID. I believe that diaper distribution itself has been happening in our communities for forever. And there are a lot of great organizations, community action agencies, and community-based organizations, small to mid-size, that are very focused on providing this resource to families. Our partnership with the Diaper Bank of Connecticut, which is really the acute care hospitals across the state, is an opportunity to support that work by really augmenting the ability to measure impact of providing diapers by demonstrating how this provision of diapers can influence the health outcomes of children and families at a large scale. So at a very basic level, was an opportunity to scale diaper distribution readily during that time, because the way hospitals are distributed across the state allowed the Diaper Bank of Connecticut to readily expand their distribution network with additional community-based organizations who have partnered with our hospitals through this program. So Diaper Connections really is a partnership between the hospitals and the Diaper Bank to systematically screen for diaper need, track the distribution of diapers, and ultimately measure impact of supporting this need through data analysis. And overall really support that advocacy work that Jillian Gilchrest just talked about as well.
Yeah, and this is one of the first programs that's really actually screening for diaper need, correct?
Yes. So, hospitals in general are very dedicated to supporting the families we serve in our communities, and screening for social determinants of health needs is just a matter of process, due diligence that hospitals do. And typically, you think about food, housing, transportation, utilities as primary needs that families have. And diapers is almost like an outlier, right? It's so unique and different, but like what we've discussed before, is almost like a root cause of the economic viability of a family. And so making hard decisions of providing diapers for your child, and paying for electricity or paying rent, it's all interconnected. So to the extent that hospitals or some of our members are on the call now are able to readily screen for need, provide the diapers, connect the family to a resource in the community, it goes a long way in making sure that we are readily able to support the families.
Great, thank you so much. And the program actually just released its first report. Were there any major findings or anything that you really think is pretty significant?
Yes, sure. In the first year of implementation, what's really pertinent is that we've been able to support over 2,000 children with over 1 million diapers. I think what's also been very significant is the insights that participating hospitals have been able to provide, which is beyond funding the products, right, the diapers to distribute to families, the significance of really planning the infrastructure that it would take to equitably distribute diapers to families consistently. And it would take a lot more than just making products available. And to the extent that we continue to really improve our process and highlight those insights, we're hoping that we will contribute to the Medicaid coverage for diapers advocacy work.
That's really awesome. Thank you so much, Dr. Osei. And so for Janet, this was a pretty big undertaking for the diaper bank, along with CHA, for all parties kind of involved. Just can you speak to where the program's at for the diaper bank currently? Just how's it going?
Thank you. That's a great question. Honestly, we're thrilled to be able to partner with CHA and all the hospitals and community-based organizations involved. And on the distribution side, it's very similar to how we have worked with partners over our 20-year history. I think the really exciting and potentially the most impactful piece of this is the ability to, collect the screening data on diaper need up front, and then the potential health outcome data on the back end. Honestly, that is really, to me, the most important thing. I think, the other thing that is critical is that getting all of the acute care hospitals to sign on to do this was not a small thing. And honestly, I really thank the folks at CHA for leading the work and for ensuring that the hospital leadership truly took this on as an issue and is leading a lot of that advocacy work because they are now understanding, if they already hadn't, but most of them had, understanding how critical this is to families, and that, why the diaper research around moms and maternal depression and stress was so important is, we asked moms what was stressful and they told us, and we're responding to that. And so we want to be responsive to the needs of the families that we serve. And that research is, that empirical data that is so often needed to make the case on the advocacy side for why something is so critically important to families.
Thank you so much, Janet. So for Representative Gilchrest, can you kind of, from a more legislative perspective, just how does this data, like the data that's being collected through Diaper Connection, really help to influence decision makers and kind of influence the policies that are being brought up?
Sure, great. Yes. So in order for Connecticut to be successful in getting a health-related social need waiver from Medicaid to cover diapers, we need to be able to have a clear implementation plan, be able to show clinical outcomes, and be able to make the medical link. And so this data from Diaper Connections really just goes hand in hand with that. Because, you heard the fact that they're measuring impact and then the health impact through distribution, we'll be able to use that data on what this looks like and how it's connected medically to inform our application. Additionally, through the work of the Diaper Bank of Connecticut overall, and then through Diaper Connections, understanding how best we would distribute what populations to focus on. Because while at the end of the day, I'd love to be able to use Medicaid to cover, everyone on Medicaid, we do need to be targeted with this application. And so I think that this data is going to allow us to do that.
Awesome. And I'm curious, are we seeing other states that are doing something similar, or is Connecticut really sort of a leader in this space?
So we do know that 2 states currently, Delaware and California, are having these conversations about Medicaid coverage for diapers, but no state has actually applied through the waiver program. So Connecticut would be first, which as an optimist and someone who, why not go for it, I think is a positive. At the CMS level, they really are more inclined to approve health-related social need waivers that are linked to housing or food at this point in time. But that's not to say that they won't accept the diaper. Again, though, that just really is, we need a tight proposal. And that's why I think the fact that we have already the Diaper Connection going on here in the state makes us a likely candidate to be the first.
What do you see as sort of like the biggest oppositions? Like, what are you hearing from folks that, might think the idea is great, but aren't necessarily on board with the actual policy? And how can folks on this call, what is the, what should we be aware of as opposition?
So the biggest opposition I'm hearing is that it hasn't been done yet. But I wouldn't be in public policy if that was what stopped things, because that's why we need to change stuff. What I think the positive to that opposition is we could, as a state, apply for a Medicaid waiver that addresses housing, food, and diapers. And if the federal government at this point, if CMS says, you know what, we're not there yet, they could take out the diaper part and we could continue on. So it wouldn't ruin our chances for the other 2 pieces. I think that at first was people's fear that, oh my God, if we went all in for all 3 and didn't get the diapers, we'd lose the other 2. I don't believe that's the case. And so I think the other opposition that we heard last year was this confusion around, well, aren't we already giving funding? And that's that piece that I think would be helpful. Like, yes, we do give funding to the Diaper Bank of Connecticut, but the need is so great that actually I think if we can use Medicaid, which again, positive, we get a federal match, so it's not all state dollars, we can help those who are of the lowest income, right, get access to diapers. And as Janet was talking about the Alice, we know that there's families who are above that poverty level who also need access to diapers. And so we'd actually be able to support those families who are experiencing the greatest economic disparities with access to diapers through Medicaid, loosening up some of the dollars for the other families who also are in need.
Wonderful. Thank you so much, Rep. Gilchrest. So Merrill, I'm curious, with Diaper Connections and some of the thoughts around Medicaid, one of the goals is, sort of identifying this diaper insecurity right at birth and ensuring that babies throughout their development are getting the supplies that they need. And I was just curious, in terms of childhood development, how does having access to these basic essential items really impact, the childhood development, I suppose? Oh, I think you're muted.
You wouldn't know that I do a Zoom meeting every Monday. So early detection of problems and addressing them early, regardless of what you're talking about, makes sense. when you have a family that, for instance, can't take their child to daycare because they can't provide diapers, that means that the child is having their care interrupted, means the parent can't go to work. There's a cascading set of consequences resulting from that. Not to mention the link to maternal depression. That this is sort of, this is one of those urgent things that impacts a whole spectrum of issues. I've heard people talk about, the reason that low-income parents make seemingly bad decisions is frequently because they just don't have the bandwidth to reason out other things. It's like if somebody said, here, do this math problem. Oh, by the way, I'm now going to turn a siren on outside. There's going to be someone shooting outside, and there's going to be water leaking through the ceiling on you. But keep doing that math problem and see how fast you get it done. The more things coming at you, the harder it is to reason things out and do things that other people might be able to do easily. And that anxiety that goes with diaper need is a very high anxiety, high urgency issue. So helping families address that makes it easier for them to address the other challenges that they might face. And low-income families face lots of challenges that the rest of us think of, oh, well, the tire just blew. Okay, so I've got to, get the credit card out and get a new tire. That's not, if you don't have a credit card, it's more challenging. If you've already spent the money that you could use on the tire to pay your phone bill, and you still need to pay for groceries, and you still need to pay for diapers, all of that just accumulates. So the better a job we can do at identifying and addressing this urgent need for families, the easier we make it for families to deal with all the other stuff that comes at them.
Yeah, definitely. And I'm wondering too, sort of on the other side, talking more about the care providers, the Early Childhood Alliance works with a broad spectrum of nonprofits, all sort of in the early childhood space. And I'm wondering how diaper insecurity has impacted the providers. Are you seeing, care providers buying diapers out of their own costs, critical funding for these programs going towards diapers? I'm just curious how that kind of looks.
Yeah, I would say there's a whole spectrum of the way that different types of providers deal with that.
Mm-hmm.
Family child care providers tend to have a much closer connection to the family than, say, at a big center. And so family child care providers are frequently dipping into their own pocket to help their families deal with the stuff that comes at them. And, that's when you look at the research that says that on average, they're working 68 hours a week and earning an average of $8.50 an hour for those 68 hours a week. You see how wrong that is, that they're having to pull out of their own money to help their families. But they also understand that, if I've got two kids from one family and one of them needs diapers and mom doesn't have the money for diapers until the next paycheck, that if I don't provide them for her, then she might not be able to come, and then I might have two spaces not paying tuition. And so then that has a direct impact on the provider. On the flip side, in a big center-based program where they may just have a hard and fast rule that no, if you don't have diapers, you can't bring your child, that creates problems, obviously for the family and for the employer, but it has an impact on the program as well, in that you've got just inconsistency in everything.
Right, that makes sense. It's such an intersectional issue for kind of all involved. And I want to ask, so for Janet, this is a particularly challenging time for nonprofits. How is the discontinuation of COVID-related funding impacting the diaper bank's ability to serve families?
Yeah, thank you, Jenny, for that question. Like many nonprofits in many sectors, we're seeing this sort of discontinuation of COVID-related funding, while there's at the same time increased need, and that certainly has an impact on us. And we, have had to change the way we sort of spread out what we're distributing to partners across the community, and then continuously writing grants, to keep programs going and to ensure that we can continue to meet this need, which is so critical, as you've heard over our time together so far, that this small thing can impact health and well-being of children, health and well-being of moms, the financial security of the family, the small businesses that are at the core of really keeping our economy going, which is, childcare providers, whether they be center-based or particularly family-based, who are most often serving, infants, in fact, that we're cutting into their bottom line. And these are critical small businesses that keep our economy going, that keep people to work. And if you all remember during COVID, when, there was such a critical need for childcare, particularly for, hospital-related folks, medical-related folks, critical providers. That was childcare providers, and many of whom were family childcare providers. So it really does have an impact broadly. And like many folks, we're continuing to try to raise funds to ensure that we can help meet that need that is not getting any less.
So my last question is for all of the panelists. It's both a question and I suppose an opportunity to cover anything that I missed. So you can use it however you like. But my question is really, for all the folks that are on the call, obviously everyone has some sort of interest in this issue and some sort of interest in potentially addressing this issue. So my question for all the panelists is, what's your action item? How can any of our viewers, whether, we have legislators on the call, we have care providers, we have community members. So whoever you feel most comfortable addressing that to, what can folks do to sort of help with this all of it. And I'll go ahead and start with Representative Gilchrest, if that's okay.
Yes, thank you. So I'd say to those on, please connect with your legislators. And for the legislators on, I'm happy to connect with you and talk more about this work we're doing regarding health-related social needs and diapers and Medicaid. But when you speak to your legislator and share your support for this, I think very often, because there's so much need, right? We're hearing about food insecurity, childcare costs, housing needs. It can kind of be like these issues are pinned against each other when they really work in concert. And so, you've heard from Merrill that you can't access childcare, right, if you don't have the diapers. But I guess I'd want to stress with you how important it is to share the experiences you're having. So I'll quickly just share an example at our MAPOC, when it was at MAPOC, but at our meeting on health-related social needs, when we discussed this topic, one of your colleagues shared a story of an individual who started coming in to get diapers. And at first, she wasn't really speaking with anyone at all. Maybe she was fearful that she might get in trouble. I would think that there's, as a mom, I would be fearful that people might judge me if I can't get an adequate supply of diapers. And little by little, as she came back every few weeks, she then was realizing there was food available. And as she got more comfortable, he was able to connect her to other social services, to job training, and eventually she got a job. And so I think just sharing these stories of there's different ways that people come into the social safety net, but that at the end of the day, it all does work in concert. And so pushing for greater access to diapers is one piece of the pie, and we don't have to wait to do this. And again, I think a really key piece for legislators to know is that we can get matching federal dollars for these efforts.
Awesome. Thanks, Rep. Gilchrest. That's awesome. Dr. Osei, any last thoughts, action items?
Sure. I guess I would say for my part, it's really amplifying the narrative around the connection of diaper need to health outcomes. And so maybe as part of the post-event communication, you share some of the research that we talked about with participants and really making the case for going beyond the immediate solution of providing diapers and thinking through how do we talk about diaper need in relation to really solving long-term the increased visitations around diaper rash or UTI for infants, improving that part of care. And so raising awareness and knowledge about what it means to address diaper insecurity would be my little inputs for this.
Awesome. And that's wonderful. Thank you. And we'll definitely be sure to share everything. That's a great idea. Thank you so much. Merrill? Merrill, you're muted.
Okay, thought I had unmuted myself. I just want to thank the legislators who joined us today, Senator Mayer, Representative Turco, and Representative Dathan. I don't think I missed anybody else, but if I did, I apologize. For all the other folks who are here, I would really encourage you to invite your legislators into your program. If you do a public distribution, invite them to your diaper distribution. Make sure they understand what you're doing and the need in their district. It's really important for legislators who we have these expectations that they know everything, and the reality is they can't possibly know everything. And the connection to people in their district who understand the problem, you can be their expert on this issue and help them understand why it's important that they do something. It's really important for them to know somebody who knows more about the subject than they do, that they can turn to when they have a question. And it's also really important that they understand how big the need is out there, and you can help them with that.
Awesome. Thank you, Merrill. And then Janet?
Thank you. Thank you, everyone, for your comments. I think those are all wonderful suggestions. And, you know, to Selina's point, the thinking about diapers as a preventative tool to help prevent further health outcomes, poor health outcomes, and health-related expenditures that will be much more if we have to have someone go to the emergency room to treat a severe diaper rash than actually providing these diapers up front does better for, you know, the economic well-being of the family and potentially of the state, as well as the health of the child, which is what we really care about, and that we want families to thrive, not just survive, that we want young children to thrive and make sure that they have the things that they need, which is not just diapers. It's ensuring that our young children have the best start with a host of things, and that we shouldn't be pitting, you know, diaper need against housing or food insecurity, that essentially we're serving that same child and that same family. So thinking about it that way in the long term. And of course, in the short term, we are still working to ensure that families have the things that they need while we're working on these loftier goals. So certainly we always look for support in terms of resources, whether that's financial or diapers, to ensure that we can get them to families who need them.
Great. Thank you so much, Janet. So at this point, I want to go ahead and open it up to all of our guests here for a little Q&A. If anyone has any questions or anything, please feel free to just drop them in the chat and we'll make sure they all get addressed. While everyone is sort of thinking of their questions, I just want to say a big thank you again to all of our panelists for your insight and your expertise. So again, if anyone has any questions, feel free to just add them to the chat. I'll give everyone a couple seconds to see if there is any. Maybe not. Okay. Awesome. Well, for everybody, we'll be sure to follow up. We'll send out again the recording of this webinar. We'll send out all of the information that was talked about and all of the email addresses to the folks that are on this panel in case you have any questions. This is a great one from Kara. Any resources for diapers in the community?
We may have just lost Jenny for a moment, but I will respond to that. If you go to our website, there's a list of our community partners who are providing diapers, but there are other organizations or folks who might be reaching families who need diapers in your community as well.
And then Janet, I see the question about husky coverage. Is it okay, Jenny, if I take that? It looks like you're back.
Yeah, absolutely. Sorry about that, everybody. Yes, absolutely, Jillian. Thank you.
So great question. So the question is, would the Medicaid waiver cover undocumented women as part of the new husky coverage? So interestingly, the federal dollars cannot cover undocumented individuals. So for the waiver itself, I don't believe we would include them. That said, you're getting my own personal take. I would want to, and we have done quite a bit of work, thanks to all my colleagues at the legislature, to cover undocumented pregnant women. We're moving along with children. So I would think it would have to be a two-pronged approach where we'd get the waiver first, and then we'd potentially add the undocumented women after the fact. That would be my take, only because of that federal piece.
Awesome. Thanks, Rep. Gilchrest. And then for Janet, how can organizations become a community partner?
That's a great question. Right now I believe we're fairly close to capacity, if not close to capacity. There is a section on our website that talks about how to become a community partner. But if that is not showing up right now, certainly you can email. You can email me directly, janet@thediaperbank.org, and we can just take a look and see where we are. We are really close to capacity. So we would have to figure out if we could do that.
Awesome. All right, cool. So if there's no other questions, I just added Janet's email to the chat too, for anyone that was wondering. So if there's no other questions, again, thank you everybody so much for your time. Oh, sorry about that. I'm having some connectivity problems with my computer. I'm so sorry. Anyways, thank you everybody for your time. If you have any other questions, anything, feel free to reach out to me directly. You probably all have gotten a million emails from me, so I hope you have my email address by now. And if you have, want to follow any of this, get action alerts, any of that stuff, you can go to our website. It's thediaperbank.org and sign up for our newsletter, and we'll keep you guys all posted on everything that we have going on. So if there's no other final thoughts, thanks everybody. Really appreciate all of your time. Bye all.
Thank you, Jenny, for organizing this. This was wonderful. Thank you.